Hello everyone. In this video, we'll try to understand what are the different phases of cardiac cycle. We know that it has atrial events and ventricular events. In this diagram, the outer circle represents ventricular and inner circle the atrial events. We have to draw two circles and we have to divide them into 8 equal divisions. So aortic's cardiac cycle starts from atrial systole, then followed by atrial diastole. Atrial systole lasts for 0.1 second and atrial diastole it lasts for 0.7 second. After atrial systole, we have ventricular systole, which lasts for 0.3 second. So this is for 0.3 second, and ventricular diastole, which is going to last for 0.5 second. In ventricular systole, again we have different phases which can be divided into isovolumetric contraction. Isovolumetric contraction, which lasts for 0.05 second. Then we have the rapid ejection phase, which lasts for 0.1 second. Then slow ejection phase, which is going to last for 0.15 second. Then in ventricular diastole, we have again different phases. The first phase is protodiastole, which is going to last for 0.04 second. Then we have isovolumetric relaxation, which is going to last for 0.06 second. Then we have rapid filling phase, which is going to last for 0.1 second. Rapid filling phase, which is going to last for 0.1 second. Then we have diastasis or slow filling phase or diastasis, which is going to last for 0.2 second. Then we have last rapid filling phase, which is going to last for 0.1 second, which corresponds to atrial systole. After atrial systole, when the ventricle fills with 100% of the end diastolic volume, and when the ventricular systole begins, that increases the pressure in the ventricle and it closes the AV valves that will be responsible for production of the first heart sound. At this point, both the semilunar valves and AV valves, they are closed, and ventricular systole, it increases the pressure inside the ventricle, and this phase is called as and the volume is going to remain same but pressure increases, so this phase is called as isovolumetric contraction phase, and this lasts for 0.05 second. After this phase, increasing the pressure, it is going to open the semilunar valves. The opening of the semilunar valves causes the entry of blood into the aorta, which leads to rapid ejection phase, which will be followed by slow ejection phase, which is going to last for 0.15 second. Then the ventricular diastole starts, and at this point the aortic pressure increases more than that of the ventricle, and there can be a backflow of blood from aorta back into the ventricles that causes the closure of the semilunar valves, and this causes the production of the second heart sound. And the phase between the beginning of the diastole and the closure of the semilunar valve is called as protodiastole. At this point, again, both the semilunar valves and AV valves, they are closed, and the ventricle is relaxing, so that decreases the ventricular relaxing, so there will be a decrease in the pressure without the change in the volume, and that phase is called as isovolumetric relaxation phase. After this phase, the pressure in the ventricle is low than the atria, so that causes opening of the AV valves, and it is going to begin the rapid ejection phase, which will be followed by slow ejection phase, where the from atria blood directly enters into the ventricles, and this phase is going to last for 0.2 second, and this will be aided by the last the ventricular filling will be aided by last rapid filling phase, which coincides with the atrial systole. 30% of the ventricular filling occurs because of this last phase, and after which the again systole begins, where the pressure inside the ventricle, it is going to cause closure of the AV valves, and the cycle is going to be repeated.